Let's talk about something important and often overlooked: lower abdominal pain during sex. This is a topic that many feel uncomfortable discussing, but it's crucial to bring it into the open. It's more common than you might think, and it's absolutely something we should discuss openly. Many women experience this, and it's important to know you're not alone. You're not alone if you've experienced this. It's a shared experience for many, and acknowledging it is the first step towards finding a solution. It can be really distressing, both physically and emotionally. The pain can affect your quality of life and your relationships, making it a significant issue that deserves attention. But remember, there is help available, and it's often very treatable. Seeking professional advice can make a huge difference. It's important to understand the potential causes so you can get the right support. Knowing what might be causing your pain can help you and your healthcare provider find the best treatment. Sometimes the cause is easy to address, and sometimes it requires a bit more attention. Either way, taking the first step to seek help is crucial. Either way, knowledge is power. Educating yourself about your body and the possible reasons for your discomfort can empower you to take control of your health. Let's dive into some of the common reasons why you might be experiencing discomfort and what you can do about it. Understanding these reasons can guide you towards effective solutions and improve your overall well-being. When it comes to pain during sex, there can be several culprits. Sometimes it's related to infections. Other times, conditions like endometriosis or pelvic inflammatory disease, PID, might be the root cause. Don't worry, we'll break down each of these in more detail in the following sections. In addition to these conditions, ovarian cysts or fibroids can also lead to discomfort during intimacy. And it's not always a purely physical issue. Sometimes lifestyle factors like stress, or even something as simple as not enough lubrication, can play a significant role. Infections are a common culprit behind discomfort during sex. They can disrupt your daily life and affect your overall well-being. Think of it like this. When your body is fighting off an infection, inflammation is often part of the process. This is your body's natural defense mechanism. This inflammation can make the tissues in your pelvic area more sensitive, leading to pain and discomfort during intimate moments. Common infections that can cause this type of pain include yeast infections, bacterial vaginosis, and other bacterial infections, or sexually transmitted infections, also known as STIs. These infections are often spread through sexual contact. These infections often come with other symptoms, like itching, burning, or unusual discharge. These signs should not be ignored. The good news? Infections are typically treatable with medication. Early diagnosis and treatment can prevent complications. If you notice any of these symptoms, it's essential to see your doctor or a healthcare provider to get the right diagnosis and treatment. Don't hesitate to seek medical advice. Let's talk about two other conditions that can cause pain during sex: endometriosis and pelvic inflammatory disease, or PID. These conditions are often misunderstood and can significantly impact a woman's quality of life. Endometriosis occurs when tissue similar to the lining of the uterus, known as the endometrium, grows outside of the uterus. This tissue can be found on the ovaries, fallopian tubes, and even the intestines. This can cause inflammation and pain, especially during sex. The pain can be chronic and debilitating, affecting daily activities and emotional well-being. Pelvic inflammatory disease, or PID, is an infection that affects the reproductive organs, including the uterus, fallopian tubes, and ovaries. It is often caused by sexually transmitted infections, like chlamydia or gonorrhea. It can lead to scarring and inflammation, which can also cause pain during intercourse. The scarring can block the fallopian tubes, leading to fertility issues. PID often causes pain that is not related to sex, such as pain with urination or bowel movements. Other symptoms may include unusual vaginal discharge, fever, and irregular menstrual bleeding. If you suspect either of these conditions, it's crucial to consult a doctor. Early diagnosis and treatment can prevent complications and improve quality of life. They can perform tests to determine the cause of your pain and recommend the best course of treatment. This may include medication, lifestyle changes, or even surgery depending on the severity of the condition. Section 5. Ovarian cysts and fibroids. Potential contributors. Ovarian cysts and fibroids are two more possibilities to consider. Ovarian cysts are fluid-filled sacs that develop on the ovaries. Most cysts are harmless and go away on their own. However, some cysts can grow large and cause pain, especially during sex. Fibroids are non-cancerous growths that can develop in the uterus. Like cysts, they can sometimes press on surrounding organs and cause discomfort, including during intimacy. If you experience pain that you think might be related to cysts or fibroids, talk to your doctor. They can assess your symptoms and determine if further investigation is needed. Section 6. Lifestyle factors. Stress and lubrication. Believe it or not, sometimes the culprits behind pain during sex are related to lifestyle factors. Stress, for example, can manifest in our bodies in surprising ways. When we're stressed, our muscles tense up, including the pelvic floor muscles. This tension can make sex uncomfortable. Another common factor is lubrication. Our bodies naturally produce lubrication, but sometimes it's not enough, especially as we age or experience hormonal changes. Insufficient lubrication can lead to friction, which equals discomfort. Using a good quality lubricant can make a world of difference. Section 7. Seeking help. Diagnosis and treatment. Experiencing pain during sex is never something you should ignore or feel embarrassed about. Remember, you deserve to enjoy intimacy without discomfort. The first step towards finding relief is talking to your doctor. They will listen to your symptoms, ask about your medical history, and may perform a physical exam. In some cases, they might recommend additional tests, like an ultrasound or blood work, to get a clearer picture. The goal is to identify the root cause of your pain so that you can receive the most effective treatment. Section 8. Treatment options. A multifaceted approach. Once your doctor has identified the cause of your discomfort, they'll work with you to create a treatment plan tailored to your needs. Treatment options vary widely depending on the underlying issue. For infections, antibiotics or antifungal medications are often the answer. Hormonal therapies, such as birth control pills or hormonal IUDs, can be helpful for managing endometriosis. In some cases, surgery might be recommended to address structural issues like fibroids or cysts. Section 9. Finding relief and support. Remember, you are not alone in this journey. Lower abdominal pain during sex is a common issue, and there are resources available to help you find relief and support. Don't hesitate to reach out to your healthcare provider, a trusted friend, or a support group. Open communication with your partner can also make a world of difference. By working together and seeking professional guidance, you can overcome this challenge and rediscover the joy of intimacy.